refresh the ACNM for cardiovascular diagnostic services. I'm here to show you the basic setup, what you want to do before the doctor comes to do a portable bedside TEE, what you want to have ready, and what you can expect when the doctor comes. So this is your patient. You're going to want to have the setup like this with the three-way stopcock ready for the bubble study portion of the TEE, and it's also an easier way to do your moderate sedation if you're using moderate sedation. First of all, before they come, you're obviously already monitoring your patient, but a few things to keep in mind. You want to have your end tidal CO2 monitor set up, and that, if you're not doing that already, requires a special nasal cannula that you'll have to get with the end tidal lip, or I don't know the official term for that is, but that's what monitors. That's for monitoring that. And then I always have an oxy mask ready too at the bedside in case your stats start to drop. You're ready to get that hooked up and going. You will need a bite block for your patient, which the doctor will put in their mouth himself or herself when the patient is sedated. If you don't have that on your floor, don't worry. The sonographer does bring this pouch along, and they are in here. You're gonna want a towel because things get messy. The patients drool a lot, so you'll want a towel down by their face. And then always have suction ready. You're gonna want your 14 French suction and then a Yonker as well. You do use both quite often. And then the other thing you're gonna wanna be prepared for if you're using moderate sedation is you're gonna be using typically 1 to 5 milligrams of Versed and 50 to 250 micrograms of fentanyl. And you won't be getting those out of the Omnicell ahead of time because you won't have the order, but I do get my syringes ready and labeled so you're ready to go. You're gonna want a whole bunch of flushes. And then if you have this available, you're gonna want your lidocaine cup. I use a syringe. I suck it up into the syringe, and I put it in the patient's mouth instead of having them drink, but whatever is better for you, because you're gonna have to be prepared to numb the patient's throat.
You numb them with, they do a gurgling motion with that
Yes.
lidocaine, correct?
I have them hold this in their mouth for 1.5 minutes. And during that 1.5 minutes, we do about 10 seconds of gargling if the patient can tolerate it. And then they swallow it. Then, again, the sonographer brings this when they come. You're going to want to use a spray lidocaine. And it comes with these, this is in the pouch, so that you can go in their mouth and do a bunch of spraying as well.
And you're showing an extension, correct?
Yep.
Okay.
So I don't know. This will go on. Okay. So that's all in prep. You'll be ready to do that as soon as a team shows up.
And then Meg, the normal flow is you'll prepare as much as you can of the room with getting ready for the bubble study, the oxygen and airway supplies you need, and what you can set up for the medications. But ultimately you have to wait until the team arrives, as the doc has to do an assessment of the patient, do the consent, and then put in orders for all the medications we discussed, correct?
Yeah, correct. And so once the patient or the doctor has done the exam, the note and the orders, that's when you're going to the Omnicell and getting your actual drugs and getting them ready, and then doing the consent.
and then there will be a timeout process, and then the doctor gives verbal orders throughout the procedure of how much of each medication to give.
Yes, the doctor will go through the timeout with you, and you'll be doing the backside of the consent, all the check-offs there, and then the doctor will proceed to tell you how to sedate. So it's not the nurse's decision. You're just ready to give what the doctor says. And how I do it is the doctor says, Meg, give 1 milligram of Versed. This is how I like to do. Of course, you're going to have your clean technique with your alcohol wipes, but I put this on and then give my 1 milligram of Versed. So you're gonna turn the stopcock. You're gonna give your 1 milligram. You're gonna close the stopcock. Take this off. Put that away. Turn the stopcock and give it a full flush. I do it with each. That's why you need a lot of saline, because with each dose, you're gonna give a full flush in so the patient gets the whole thing. Then you're gonna shut it, put on your new saline. So I should show you this saline will be empty because you just flushed. You have to get pretty good with your hands. And of course you're wiping as you go with your cleaning supplies. And then you close it. And then the doctor will say, okay, now give 50 of fentanyl. So then you'll get your fentanyl. This saline comes off, goes in the trash. Fentanyl goes on, you churn, give the 50, close it, take this off, then you're gonna do this and give your flush. I'm not gonna do the whole thing, but you're gonna do the whole thing. And then it just keeps repeating. You get your new flush, you put it on that end, this one's empty, you give your third dose through there, and you just keep switching.
Great, thank you, Meg.
Thank you.